Hi, this is Jeff Wahlberg from Ortho Pro Physical Therapy and the Runner's Clinic, and today we're going to talk about posterior tibialis tendinitis, which in many circles is one of the shin splints that many runners can get. The posterior tibialis, this is a left foot and leg. Posterior tib is a muscle that runs on the inside of this shin bone or the tibia, and it goes all the way down around this bone and attaches to the center of the arch of our foot. And it really has two jobs when it's working and running. Number one, when we're landing on the ground, if we need to pronate or turn in, that muscle's job is to control that amount of pronation. It pulls up to minimize that pronation. So it's acting as a stabilizer. The second job of that muscle is in the takeoff. When we're on our toes, that muscle is assisting the calf muscle in the push-off. So if someone is an overpronator or they turn their foot too far in, that's going to make that muscle work harder. If someone is running with a delayed takeoff, leaving the ground too late behind their center of gravity, behind the center of gravity of their body, that's going to make that muscle work harder. So you're going to develop a tendinitis or a shin splint in that inside shin area. The treatments for this are several. My thoughts on ice is that while ice is a wonderful way of keeping inflammation down, I would rather prevent the injury than have everybody icing down after the injury is already there. So some simple things that you can use to prevent this. Number one, make sure you have a good technical shoe fitted for your particular needs. If you're an overpronator, you need a shoe with more motion control. A second thing that we do here in the clinic is we use a taping technique on the underside of the foot that can stabilize the foot and minimize the workload on that muscle so that while you're running, the injury can still get better and go away. And last but not least, I think the most important thing that you can do is make sure that your form and your cadence are optimized. We teach neutral landing, early takeoff, and an optimal cadence that minimizes the workload, increases the efficiency, reduces the injuries. So call us up if we can help you. Otherwise, good luck and happy running.